From your PHLV radio family, Merry Christmas and all the best in the coming year.
Merry Christmas from your friends at PHLV Radio. The Asian American Pacific Islander Nurses Association of Nevada presents Healthy Mondays with AAPINA of Nevada. Start the week healthy and right with interesting conversations on living a healthy lifestyle. And now, your Healthy Mondays host, Dr. Mary Faye Axon Armstrong.
Aloha! Good evening. Magandang gabi po sa inyong lahat na imbaga sa Ardam. Maayong gabi sa inyong tanan. I'm yours truly, Dr. Mary Faye Axon Armstrong, founding president of the Asian American Pacific Islander Nurse Association of Nevada and professor in nursing at Roseman University of Health Sciences, College of Nursing. Here we are again on a Monday night. Thank you for tuning in. Maraming salamat po sa inyong pakikinig sa aming programa at patuloy na pagtangkilik sa mga topic na inahandog namin sa inyo. So tonight is very special. Every night is special. Healthy Mondays. I have my colleague and friend, Dr. Mandal, who's going to give us information about the new COVID-19 variant, which is scary that he told me. And we were just talking earlier about the information, but I wanted to say Mele Kalikimaka and Haoli Makahikiho. I think it's not too early to greet all of you Merry Christmas and Happy New Year in Hawaiian. Maligayang Pasko at manigong bagong taon sa inyong lahat. So inihahandog namin sa inyo itong programang ito para kayo ay maging aware sa mga events, especially health information. So I wanted to invite Manas to share with you his background.
Yes. Thank you, Marife, for once again inviting me on this platform. And a Merry Christmas and Happy Holidays to all the listeners out there. I'm Manas Mandal, professor at Roseman University College of Pharmacy. My background is immunology and vaccine research. Since this pandemic began, I was following this infection very closely along with our colleagues, and many times we have talked about the COVID-19 infection, development of the variants, the current vaccines, their immune protection, etc. Today, as Marife mentioned, that there is a growing concern in this era of COVID-19 pandemic. We all thought that past the Thanksgiving and into the winter, maybe things will ease up a little bit. We will go back to slowly in our normal life, meeting up with our friends and family, have a nice Christmas dinner, going to the shows and movies, just relaxing a little bit after grueling almost 2 years now into this pandemic. But unfortunately, with the emergence of one more new variant out of South Africa, things are getting a little tighter. Today we are going to talk about this new variant, which is known as Omicron variant, and as much we know about it at this time.
Yes, I know it's a little scary because Manas was telling me about how scary it is with the report that he's holding in his hands. And I just wanted to just plug in an app that was developed before we dive into the Omicron, developed by the Nevada Department of Human Health and Sciences. Have you heard about COVID Trace, like TRACE in Nevada? It is a contact tracing mobile app developed by the Nevada Department of Human Health Resources that uses a technology called Exposure Notification System from Google and Apple. And the app, I haven't tried it, and after this I'm gonna try and see, because the app exchanges anonymous information with other phones in your vicinity, and guess this, and can notify you if you've come in contact with someone who has tested positive for COVID-19.
Yes, I have heard about this app. I personally haven't tested it or tried it on my phone. This app was, if I'm not too wrong, first really well utilized and developed outside US, South Korea, followed by Middle East in United Arab Emirates, in those areas, early on in the COVID-19 pandemic, this app was instrumental for contact tracing and informing people if someone got infected. Now, with the phone app, all the other phones surrounding that individual, their phone numbers and their movements can be somewhat monitored and a notification will come. What it does is that if someone gets detected positive after testing, then with their phone number, the information travels wherever that individual was prior to that positive testing, what were the adjoining phone numbers with that individual or surrounding that individual, every other individuals who were in close contact or in close vicinity of that positively tested individual who is infected now, the app will notify the other individuals, go and test yourself. Watch out for the signs if you got any infection. So this was really very instrumental in South Korea, who had the least number of infections in them and the lowest mortality in the world. And they opened up their society, their systems earliest in all over the world. This is the app. If everyone downloads and agrees to utilize that app, accepting it, it will help us all around, that not only tracing but also informing the individuals who may be in close contact with another infected individuals. Otherwise, I would not never know if I am in a supermarket or in a mall or somewhere in the strip. I would not know who is around me and whether that individual or individuals are infected or not. But through this app, I can get informed that yes, you have been in close contact with another infected individual. So take precaution.
Yes, it's a good way of early intervention.
Yes.
And how technology works. I mean,
Yes.
it's a good thing and a bad thing. Sometimes because of privacy, right?
There is always a
nobody-
concern about the privacy.
Yeah.
Yes, when technology is used for right purpose,
Yes.
with the right intention, then it helps us collectively as a society. But technology can be misused, and not everyone is comfortable
Yes,
using
it
the
is.
technology and informing about their location, about their presence to other individuals who they do not know. So there has to be a trust built on, and people need to kind of buy into the technology. Only then they will be comfortable to use the technology to their benefit.
That's the key. And one population I know that is vulnerable for not having access with this type of technology are our older population.
Elderly populations
Yes.
all over the world, including in US, in our valley. And by many ways, they are the most vulnerable population regarding COVID-19 infection, because it is very difficult as such for them even to go for a testing, go for a vaccination, go for a booster dose. But with this technology, things could be very little bit easier for them and helpful for them.
Well, Manaz, we were talking
Yes.
earlier. I know you have the most updated, fresh from the press information about the Omicron, but remember I was asking you,
Yes.
what about here in Nevada? We're right here.
Yes.
Do we have anyone who tested positive for Omicron? So
Let's
maybe
talk
you can
about
share.
it. Yes, let's talk about it, Marife. Yeah. So a couple of days back, I had an invited webinar to give to Indian folks that I work with. They are my colleagues in India. They invited me to give a webinar on the variants and vaccine efficacy. Around that time, I started also learning about this Omicron variant. This is a very newly emerging variant, originated in South Africa, sometime in the first week of November. There are stories how it was detected first in one female individual who actually is a lab worker. Most likely, I could be wrong, but she could be a nurse in a hospital in South Africa. Anyways, she got infection and she was quarantined. But through genomic sequencing, it has been observed that she has been infected with a newly variant of COVID-19. Now, what is a variant? Variant is there are some genetic mutations that always occurs in a virus infection. For example, seasonal influenza infection always mutates. Therefore, every year we have to reformulate the influenza virus vaccine, and that's why we need to take influenza virus vaccine every year, because viruses always mutate. Next question, how and when they mutate. Viruses can only mutate once they are inside someone, meaning in an infected individual. Other than that, viruses cannot and do not mutate. So COVID-19, when infected some individuals in South Africa, they mutated. Why there was a mutation in South Africa with Omicron variant? Because overall immunization rate in South Africa is very low. It's hovering around 35-36%.
For various reasons, right?
Yes, that is the
Access to
reason.
it, yes.
Many unvaccinated individuals, they have a higher chance of getting infection. Once they are infected, viruses will have an easy time to mutate in them. So what is the specific mutation about Omicron variant? The mutations in what has been seen in Omicron variant is about 32 different mutations in the spike protein that binds to the receptors in our body, S2 receptors, to set up the infection. And there are about 12 other additional mutations into the receptor binding domain, another area of the spike protein that helps facilitate entering the virus into our body to set up the infection.
It's almost like if you have an enemy,
Yes.
and you come across them on the street, and then, oh, that's an enemy right there.
Right there.
Then if the enemy found out that then they're
Yes.
going to
They
change
camouflage.
their
They camouflage. They put up
characteristics.
yes,
Yes.
they camouflage themselves. Then I do not recognize them out on the street. So absolutely, that's the right way to look at it, because our current COVID-19 vaccines worldwide, including US, have been developed targeting the spike protein. Now, if there are changes in the spike protein, then the antibody that we have developed with immunization, with the original infection, if someone got infected with the original strain, those antibodies may not be able to detect the variants, means changed virus, which is the Omicron variant. As if I have a key to open up a specific door, but I have changed the lock.
Mm-hmm.
The old key would not work on the new lock.
Yes, but somehow those who are, we were reading the information about
Right.
that those who had tested positive for Omicron actually were those who were already fully vaccinated.
Yes.
But did not have the booster yet,
doses.
right?
Yes, sure. The very recent, as of today, CDC released a 5-page report. I was reading the summary as I was traveling with Marife to come to the studio for this recording. It's very intriguing. But the scientific fact is that so far, Omicron variant has been spread to about 24 different states in US, about 45 different countries worldwide. We do not have any scientific or clinical information whether Omicron variant is present right now in the valley or in the state of Nevada, but it will be known in next several days whether we already have a presence of Omicron variant in Las Vegas Valley.
It's a
But
temporary good news.
It's a temporary good news, but the scientific report, what it states that CDC tracked about 43 people in US with a confirmed diagnosis of Omicron variant infection. Out of 43, only one individual got to be hospitalized. And more than half of those individuals aged between 18 through 40 years of age.
They're still young.
They are young.
Yes.
About 75%, two-thirds of those individuals received vaccination, meaning original vaccine, means original spike protein specific vaccines that we got early on, that may not be fully protective against this Omicron variant, but who received a booster dose, they increased their antibody response a little bit compared to the original vaccine doses, 2 doses of Moderna or Pfizer doses. If someone got a third dose or a booster dose, they have increased their immunity. They have increased their antibody level.
The efficacy. Yeah.
Those increased antibody level in the boosted individual is highly protective against this Omicron infection, not sending them to the hospital, not triggering serious infection. Even the vaccinated individuals who got this infection, their infection was not serious enough to send them to the hospital.
So the key is they could still get the virus. However, because you have some protection,
Some degree
it's
protection.
not 100% protection. Again, emphasizing that.
Yes.
But you will not have to go to the
Serious
hospital.
infection.
Very mild symptoms.
Yes. Hopefully it will remain mild. We do not need to go to the hospital to get life-saving treatments and etc. But these are very preliminary information, and similar information. The good news with this is that similar information, similar clinical observation came from South Africa, where this infection was originally detected, meaning it has been observed the infected individuals in South Africa with Omicron variant are not developing serious disease. Disease is milder compared to the Delta variant, and majority of them are not requiring hospitalization to get over with this infection and go back to the healthy condition. Another information I wanted to share in this line here. Worldwide, at this point, still the Delta variant is the majority of the infection, COVID-19 infection. That is the strain driving the majority of the over 90% of the infection with COVID-19 is coming due to Delta variant infection.
And I wanted to share,
Yes.
sorry to interrupt. I wanted to share when maybe probably a couple of weeks ago, when I was still in the hospital, in the clinical setting.
Right.
And without mentioning the facility itself, when I had taken my group of 8 students for their training in the hospital, on our first week, so we had like 9 12-hour shifts. On our first week, there were maybe a couple or 3 patients who tested positive for COVID with the Delta variant. The following week, it had doubled.
Yes.
Until on our middle of our clinical rotation, there were like about 50% of the people in the unit were tested positive. Of course, they're on isolation. The good news is they all have very mild symptoms. And all the treatments are the standard treatments.
Are working in them.
Yes.
Working, yes.
And eventually they get discharged back
yes.
with instructions, right? So we're doing really good as far as protecting ourselves.
Yes.
But then those people
Who are unvaccinated
unvaccinated are still
largely unprotected,
Yes.
and they are vulnerable against Delta variant infection and of course Omicron infection. I can corroborate that information with my experience. So I was interviewing yesterday for our upcoming interview admission session with one of my students who is a third-year student rotating at ICU at the Valley Hospital System. She actually shared the similar information. Since she is rotating at ICU setup care, she is seeing all the COVID-19 infected individuals. What she told me is scary. Almost all the ICU admitted COVID-19 infected individuals never got their vaccines. Almost everybody is clinically obese individual. At this point, obesity is the primary cause or primary comorbidity condition for COVID-19 infection.
and they're the younger population.
In the
too,
younger
in their
population, and the
30s,
age
right?
group is in the 40s,
20s.
mid-40s.
Yeah, 20s,
They have high BMI rates, and many of them have BMI level over 30. So this is the time for our community to pay attention. Again, unfortunately, if you are not vaccinated, go get your vaccines. Don't wait even more than a day. Get your vaccine today. If you are completely fully vaccinated, about 6 months back, go get your booster dose. Because when you get your booster dose, your antibody responses will go up. And a very recent Pfizer data in US shows that when someone got a booster dose, about 6 months after their original vaccination, their antibody level jumped about 25 times more. And that increased antibody level are highly protective against Omicron variant, at least at the lab setup testing.
That's good to know.
That's a very good news. Whereas, conversely, similar experiments done in South Africa in the lab setup in the vaccinated individuals, when they drew their little bit of their plasma and did the same experiment against the Omicron variant, South African vaccinated individuals' plasma, meaning their antibody did not show good protection. Actually, that showed less protection compared to the original strain. What is the difference? In South Africa, vaccination rate is low, and they do not have the booster doses approved yet. Whereas in US, our vaccination rate is around little over 60% who received full vaccination. About 70% US population is partially immunized. And a large number of individuals are also received booster doses. So in booster dosed individuals, with the increase in the antibody level, they are reasonably well protected against the Omicron variant.
And so I think although we don't have official positive Omicron infected
Detected
people here
in
in
the
Nevada,
valley,
we
yes.
still have to be alert.
Absolutely.
Since now our strip, our Las Vegas strip is now open. And there's a lot of people.
Yes.
I don't even want to go there right now, but I mean it's up to you. But you need to be protected.
You need to be protected.
Yes.
You need to wear mask. You need to maintain the distancing as much possible. And if possible, I would request the community member who are listening out there, avoid international travels. With this CDC report, about 2/3 of those individuals who were detected with Omicron variant, they recently traveled from abroad. And this variant is prevalent in at least 45 different countries, and the number is growing every day. Meaning, when people travel internationally, if they are infected and not detected, they are carrying the infection from one country to the other country. So it will be a matter of days, I believe. We will, hopefully not, but we may as well have a Omicron variant detected, clinically detected in Las Vegas Valley, but there is no need to panic. But we need to get into action. What is that action? Get your vaccines, get your booster doses, wear the mask, wash your hand, follow the safe distancing protocol as much possible. You will be safe.
Yes. After all this information we're trying to share with our listeners out there, please don't fall into the mentality that why would I even get vaccinated if it is not 100%? There is no such thing as 100%
protection against any vaccines.
Any.
But these COVID-19 vaccines are highly protective against severe disease, hospitalizations, and death. Unfortunately, we are inching towards 800,000 deaths due to COVID-19 in US. We can halt that progression to the death march.
So if you look at it that, okay, it's not 100%, and if you don't get it, you are 100% more likely to contract the virus and more likely to have
End
really
up in a severe infection condition.
symptoms.
Yes.
And so you might have to be
Hospitalized.
hospitalized and vented.
ICU, ventilated.
Yes.
And you may not make it out of that situation. Sure, this should be the time to get into action, and simple things. Roll up your sleeve, go to your nearest pharmacy, get your shot, get your booster dose. You will remain protected.
So would you rather be 100% more likely to contract the virus, or is that
75%,
25% more
yes.
likely not to get it?
Not to get it.
You're protected, let's say 75%, the lowest one.
Right.
You're more likely to be protected 75% and 25% more likely to get it.
Get it, yes.
With less severe symptoms.
Disease condition, less distress, less illness. And not only that, clinical studies show that even people who get over with the infection, meaning who are recovered from the infection with adequate treatment and etc., still many of them suffer from long-haul COVID, meaning long-term symptoms of COVID, such as fatigue, headache, somewhat memory loss, lack of drive, meaning they don't simply go out going about their daily activities of the life every day. That's called long-haul COVID. We simply do not know how these things are manifested after recovery from COVID, but don't put yourself in that shoe. You do not need to go there. You can protect yourself. One can protect yourself from being infected to begin with.
We cannot emphasize enough the importance of the immunization,
Yes.
not only the COVID-19, because some of the information we have is once the COVID-19 global pandemic came about, we kind of go sideways with all the other routine immunizations that we need to get,
Yes.
especially for our teenagers, for our schoolers,
Yes.
the one who are needed to be in school. I know that my son, we were looking at his immunization requirements,
yes.
and for the college level university, they're not able to register for their classes
Right.
if you don't have.
Even that is true for the CCSD
Yes.
school system. So you brought a very good point. Certainly, a lot of people are against vaccination, anti-vaxxers, etc. But everywhere in this world, particularly in US, we always require to upload and get updated on our vaccination, required vaccination to send our kids to the school. At a workplace requirement, OSHA requirement, you have to show your proof of immunizations before you work closely with the patients and etc. Same with our pharmacy students. So requirement of a vaccine or immunization against an infective disease is not anything new in this country. It was always that way.
It's always been like
I have
that.
I have a high school going senior at Green Valley High. She is fully vaccinated and she is going through her final exams this week and next week. After that, I'm going to take her and get her a booster dose so that she remains protected.
Yes, and you have to look at, are they qualified already? You know how
Yes,
they have the
they
tier.
have as of
Okay.
yesterday, the
need to
booster
get-
dose requirement came down up to age 16 through 17.
Good. I need to get my son.
Yeah,
get-
many high schoolers
booster.
and first year college kids now can get their booster doses.
So let me quickly look into the herd immunity. What is
Yes.
herd immunity?
Yes, it's a terminology that has been described in medical textbook for over 100 years. So in simple words, what it means that if a majority population in a society, in a community are immunized, then a few who did not or could not get the vaccines or immunization in the same society or community, they remain protected as a bystander effect, because if a majority is immunized, it's expected that they will not catch the infection. Therefore, they will not transmit the infection to the uninfected individuals. But the question becomes a little bit of dicey if someone asks, what is the number
Yes.
for herd immunity? There is no a single number, but overall it is well agreed across many infections and many diseases and vaccines that around 80 to 90% people in a society, when they are immunized or vaccinated, that generates a strong herd immunity in that society. But for COVID-19, it will never go up to that level.
Yes.
So realistically, if we can immunize 75% individuals in US, 75% and above in US and worldwide, we can actually declare victory over this infection, because at that point, that is a sufficient number to estimate that yes, we have generated a herd immunity. So what are the left 25%? Worldwide, 25% individuals already got natural infection. So if we can immunize about 75% population in a country, in countries all over the world collectively, then we can declare a victory on this pandemic. Because natural infection is hovering around 35% or above all over the world. But many variants are not well protected against natural infection-induced antibody or immunity. They still need to get at least one shot of vaccine that will boost up their natural immune responses, immunity that they got through natural infection. So there is always a case for vaccination. Whenever one can get a vaccine, whenever it's available, get your vaccine.
And thank you for giving us the the overview about the herd immunity, because
Yes.
why are we trying to get everybody immunized, right?
Yes.
So I think I'm thinking about, as I'm listening to you, there's this 80-20 rule, but then you were saying that 75 to 25,
Yeah.
25-25 rule is okay.
Is okay.
Because if majority is vaccinated, those who
Yes.
are not vaccinated will not likely to to-
transmitted the infection to them.
the other people,
Yes.
right?
Therefore, they will not be infected with that infection.
Because they're already protected.
They're
So there you go.
indirectly.
You do the math, and I really think that we encourage everybody to do their part in the community so we
Yes.
can reach the herd immunity.
Yeah.
In addition to that, you still need to wear your mask, because I still see people.
Yes.
A friend of mine posted on Facebook, she was in the strip, and there's a lot of people who are not wearing their mask. And so
Yes.
I'm not going to the strip, and I don't have to, right?
Right. So, but yeah, I can tell a personal experience. So, I traveled to India in first week of September to visit my mom there, stayed with her for a few weeks, and came back home. At that point, I completed my immunization vaccination. I got to take RT-PCR test, and for about 40 hours, I wore this KN95 mask. As soon as I entered Macaron Terminal 3, I had this mask on until I exited my hometown airport in Calcutta. That would be about 40 hours. About. I did not catch infection. I came back to US safely following the same protocol: mask wearing, hand washing, and distancing. While I was waiting at the airport for the next flight, I distanced myself as much I could. I came back safely. So these simple measures, physical distancing, mask wearing, cuts the transmission, cuts the chances of getting infection tremendously, and they work.
And we have to be consistent and diligent with
Right.
following the protocol. They're just not created protocol for
No.
reason. There's
No.
a purpose.
There is a scientific
Yes.
scientific article. I was reading a recent article on Science, the highest rated scientific journal in the world. They again examined effect of mask in cutting down this viral particle, aerosolized viral particle, up to the micron level. Very scientific report. And again, with that very recent report came out in Science journal, Science, that shows that wearing masks cuts that infection up to 75% level, meaning we are talking about a couple of meters apart. If both are wearing masks, and if unknowingly one of us are infected along with this barrier, we can inhibit the transmission, chances of spreading the infection up to 75% level. Along with that, using the exhaustion system, wearing the exhaust system working properly, turning on the overhead fans as soon as one gets on the aircraft, all those things are helpful in mitigating the transmission of the viral particle. If there is an individual who doesn't even know that he or she is infected, still, if everybody is wearing mask, we can cut down the spread of the viral particle.
So there you go. That's applicable to any type of virus.
Any type of
Yes.
respiratory virus, particularly.
Yes. So the Omicron is not, well, it's not officially here yet, because
Not
I
yet.
think we're just waiting. Maybe somebody is infected, and I'm just making an assumption that we're still waiting. How long does it take for the results to come
Results
in? if we
show
get-
to detect Omicron variant, we need to the sample has to be sent into the lab. First PCR results comes within 24 hours. Then, if there is a suspicion, then those PCR results need to be reanalyzed, means the sample need to be reanalyzed with genomic sequencing. That's an additional step. Not every PCR requires a genomic sequencing, but with this emergence of Omicron variant, randomly many of the samples will be sent out for additional testing, genomics. That takes another couple of days. So altogether, within 2 days, one would know whether one is infected. Also, if the result is positive for infection, COVID-19 infection, many of those samples will be now tested for genomic sequencing. What type of infection they are carrying, meaning they are infected with a Delta variant or the newly emerging Omicron variant. So 48 hours.
So
2 days.
the virus, the Omicron virus, is here in the U.S. and because we are here in Nevada, we don't have any official
Numbers.
confirmed positive yet. But
Yes.
nevertheless, we still need to continue on protecting ourselves.
Absolutely, yes, and that is more true because in Las Vegas Valley, people travels to our valley from not only from all over the country, from all over the world.
Yes.
We want that, but want with all the safety measures and protocols in place.
Yes. So time flies when we're having
Time
fun.
does fly.
That's my cue. So one last words of wisdom, Manas, to our listeners out there to encourage them
Yes.
to do their part.
So yes,
Yes.
but really I want to end today's conversation on a positive note. Don't panic. You don't need to panic, but take adequate precaution and don't take it lightly because this Omicron variant could be little more serious in terms of transmission of the infection compared with the current Delta variant infection. So if we are adequately prepared, take all the precautions, then collectively we will get over with this new variant. And hopefully, who knows, early in 2022, next year, we should all be celebrating out of this pandemic, out of this infection, going back to our normal life.
We can only hope, right?
We can only hope, but I'm very hopeful. There are
Yes.
other signs. I want to just take one more minute to give some hopeful information. There are collectively worldwide, there are signs that perhaps this virus is losing its grip, losing its bite. Meaning, so far Omicron variant is not very severe. Although it's more infective, but it's not triggering severe disease. If that is true, then perhaps it is losing its bite, it is losing its fight, means we are winning the fight against COVID-19 worldwide. Hopefully, early 2022, we can declare victory over this pandemic.
And overcoming it.
Yes.
Yes. It's been what, 2 years, you said?
It's 2 years
Yes,
now.
Yes. Okay, so thank you, Manas, for the valuable information and for sharing your expertise and fresh from the press information. And of course, PHLV Radio, Johan,
Yes.
thank you for allowing us to have this platform to bring this important information to our listeners out there. So remember, every Monday is a healthy Monday. Aloha.
The Asian American Pacific Islander Nurses Association of Nevada has just brought you Healthy Mondays with AAPINA of Nevada.
From your PHLV radio family, Merry Christmas and all the best in the coming year.
Merry Christmas from your friends at PHLV Radio.
Just like a friend from back home.
This is your Filipino radio experience in Las Vegas. PHLV Radio.